Thank you. Welcome, everybody, to our first MVC work group of the 2026 year. Today is our first sepsis work group. My name is Rachel, and I am happy to be facilitating the work group for you guys today. Sorry, I just got to move my stuff out of the way here. Okay. All right, for our agenda, we're going to be going through our normal housekeeping and P4P credit reminders. Following that, we're going to have a presentation put on by myself and our data analyst, Janet. And this will be focusing on using claims data for sepsis QI, specifically using our MVC registry. And also, we'll be walking through a recent custom report that we did that focused on sepsis. Following the presentation, we'll give you guys an opportunity for discussion or any questions you might have. And then we'll end the work group with some of our upcoming events and updates for you. So for some of our housekeeping items, the first item is that we do record these sessions. The recording and the slides will be shared with attendees following the work group in an email. Just a reminder to please mute your microphone throughout the presentation. This just helps reduce any background noise that might come through. And then if you have any questions, please feel free to put them in the chat throughout the presentation. We will go through that at the end in the discussion time to address any questions in there. For our P4P participating sites, we do ask that you have active participation through the work group. That includes answering any polls or participating in the discussion portion. And that at the end of the work group, we will be sharing a post-work group survey link. Your feedback is very important to us. So we ask that you please complete the survey. And even if you're not a P4P participating site, we'd love to hear your feedback on the survey as well. But for P4P, you will need to select one site that you're representing for the work group to fill out that survey for. To get your engagement points for P4P. Today's presenters are going to be myself, Rachel Folk. I'm one of the site engagement coordinators with the MVC team. I'll be presenting on different ways that MVC members can utilize the MVC registry to find data on sepsis cases. And then following that, Janet Zhang, our data analyst, will be sharing an unblinded custom analytic report that she completed earlier in 2025 for one of our MVC members that focused on sepsis patients and the impact of palliative care. So going into the beginning of this presentation, most of you will be familiar with what types of data MVC provides, and that we strive to include the most relevant information regarding claims and current metrics being tracked by sites statewide. MVC can help dig deeper into sepsis-related conditions such as pneumonia, UTI, skin wounds, or abdominal conditions. MVC's data registry offers various reports providing insights into your site's claims data, and for today's focus on sepsis episodes of care. The registry provides some insight into sepsis cases in combination with other conditions and/or utilization of relevant services. Some of those services include places like home health care, palliative care, skilled nursing, LTAC, inpatient or outpatient rehab settings, and emergency departments. While some information is available on the registry for these conditions or services, which I'll show you in a few slides, some conditions or details of an episode of care are actually better analyzed through a custom analytic report, which Janet will share an example of later on. Before I get started on introducing some of the registry reports we have available, I'm interested to know more about what metrics you all are tracking for sepsis at your site or your system. So I'm going to share a poll with you guys right now. Here we go. And that should pop up for you all. I'll give you a few minutes or a few seconds to respond to that. It is an open answer question, so you will need to type the answer in. Give a few more seconds.
We have a big group today.
We
I'm watching
do.
the answers coming in and realizing there's 61 participants, and some of us type faster than others. So
Yeah, no worries. We're at 41 of 56.
Ate some salad. I'm good. Thank you. I'm good.
Okay. All right, looks like we've slowed down, so I'm going to go ahead and end the poll. And then I'm going to share our results. I don't know if that actually shares the answers with you all, but I think I'll be able to see all the answers afterwards, and I can attach that as a document to the email when I send that out later. All right, thank you so much for responding. We're going to be moving right along to our registry reports for sepsis. So I want to briefly review some of the more relevant reports that are available on our MVC registry. I'm going to kind of go through and summarize a little bit what each report is, and then we'll be diving into kind of like a mini registry review on our training site for the registry. So the first report we're going to look at is called our episode payments report. And this report includes facility, professional, post-acute care, and readmission payments within an episode of care of either 30 or 90 days. Um, it's a good way to see an overall payment for sepsis episodes of care. The next report that we'll be looking at will be called the Episode Utilization Rates Report. This shows where or what services a patient is receiving during their episode of care. It helps break down the episode payments into where the patients are receiving or utilizing care, whether it's a SNF, home health, outpatient, or LTAC. The next report will be our readmissions report, which shows readmission rates for sepsis patients and whether or not they came back to your facility or they went to an outside facility. And it gives you several different time ranges that you can look at and whether or not, um, yeah, several different time ranges that you can kind of manipulate and look at different ways. And then the following report will be the comorbidities report. This shows what comorbidities are present in patients with sepsis, including other condition categories that may be present. And it's pretty helpful for kind of looking at that and what other conditions might be impacting the sepsis cases. And then the last report will be payment by condition report. This allows you to view the number of cases by condition and the associated payment for that condition's episodes of care. And just a reminder for our reports that reflect payment or spending, we use it as an indicator of utilization of care in our data. And then just a reminder that MVC conditions are risk adjusted also, which helps with fair comparisons between hospitals that see more complex patients compared to those with fewer complex patients. Moving into the next portion of the presentation, I want to get an idea of how many of you have prior experience participating in an MVC registry review. Please take a moment to respond to the following poll. I'll give you guys a few moments to fill that out.
and I think part of us asking this question is many of you may not realize that this is a support that we offer. So just trying to gauge, if we need to be a little bit more uh, out there with that information.
Okay, looks like we're slowing down, so I'm going to end the poll. All right, so it looks like actually the majority of you have not done a registry review. So this will be hopefully beneficial for you to kind of get an idea of what you can look for on our registry for your site or sites. And then there's actually a fair amount of folks that don't even know what a registry review is. And so hopefully this will kind of give you an idea of what we offer for a registry review. This is definitely a very general overview of the registry. When we do a registry review with our members, we actually kind of take an hour to kind of go through each area on the registry with specifically looking at your site and data in each of the reports that we think will be of most interest to you. So if you do think this is something you would like to do, we'll definitely have the option for you to sign up for that. I just want to stop sharing those. Okay. All right, so next we are going to be walking through some of the reports on the registry. And we're going to show you where you can look for the sepsis-related claims data and how you might be able to utilize the information available. Give me one moment while I pull up the registry window. All right. So this is what the window looks like when you go into one of these reports that are on the left-hand side menu here in the registry. This is our training site. So it does not have all of the reports that our live registry site has, but this allows me to show you all a kind of an unblinded, well, blinded but unblinded way of looking at like a site that's not really a site, and what it would look like if it were live. So I'm going to be starting with the first report I mentioned, the episode, hold on. I forgot if I click that, it changes. The episode payments report. And I'm going to be looking at just the Blue Cross Blue Shield portion because you can see the most data within the Blue Cross Blue Shield claims data. And then you can also see and dig into the QE Medicare data as well. But I figured for today's purposes, just the one payer will be enough for our intentions. So looking at our episode payments report, I want to point out that we have a section here that are filters. And here you can select the site that you are looking at. If you only have access to one site, it will only populate your one site. But if you have access to multiple sites, you will be able to select the different sites here. And then moving down the filters, you can choose how to compare your site. You can either leave it with MVC all, and depending on your hospital type, you can choose the different areas that you want to compare to. So for example, if you are a rural hospital, you can, when you select the comparison group, you actually will be able to compare yourself to other rural hospitals. And oh, I forgot to apply. Always hit apply, and then it'll update the filters for you. So as you can see here, you can compare yourself just to rural hospitals or just to critical care hospitals, which can be helpful. So going back. All right. So after selecting comparison groups, you can also choose the episode length. You can do 30 days or up to 90 days. For looking at sepsis cases in particular on this report, you're going to want to go to the service line drop-down menu Currently, it's on all, but for sepsis, we're going to want to select medical, and that's going to populate a new drop-down menu here for condition. Under condition, you're going to want to go to sepsis. Now, that is going to populate all of these rows in the table in relation to patients who have that condition as a primary diagnosis. I'm just going to make sure my notes are going in order here. So when you're looking further down the filters, you can also modify where you're looking for the index event. You can leave it on all, or you can look at inpatient, outpatient, or just the emergency department. Be aware that if you start to add more filters, it can reduce your case counts. And if it gets to a point where there's too few cases and case suppression rules kick in, it will not show any data for you. So just be aware of that if you're at like a smaller site with less cases. You can also change the payer to look at just commercial or just BCN or leave it on all. Then there are several patient demographic categories you can look at, gender, age, comorbidities. You can look at high cost episodes or exclude them, transfer cases. And then there are a couple of diagnoses here that you can also filter if you want to look at those. Chronic kidney disease and venous thromboembolism. COVID cases, we had this in here for prior data during the pandemic. Now it's not so much of an issue to filter that in or out. And then down at the bottom, we have the different ways that you can kind of adjust the time periods. You can look annually, semi-annually, quarterly, monthly, and then you can also change the default program dates. I find that it's very easy or much easier to use the custom feature here, where you can actually type in your start date and your end date. Keeping in mind that our data only goes up to a certain date for Blue Cross Blue Shield, and if you put in a date that's like too far in advance, it'll only populate to the date that we have in the system. And then you can look at different intervals, so annual, semi-annual, quarterly, monthly. Moving over, you can kind of see the different graphs up here at the top. These are reflecting episode payment, which, as I noted before, we use to kind of indicate utilization of services. You can see a legend here at the top that kind of separates what the site is as a blue color, MVC all is the green, and if there are other hospitals that are indicated in the graph, they'll be gray. And then below is our table. The graphs at the top correspond to what row you are selected on in the table below. So if you select on total episode payment, it'll show this. You can also open up these others to kind of break out the different types of payments. So there's inpatient transfer, outlier payment, there's a professional payment, surgical procedures payment. So anything that you click on is going to adjust the graphs at the top based on that selection, which can be helpful depending on what you're looking for. There's also a readmission payment. One neat thing with this report, if you have enough cases, which is 11 or more, you'll actually be able to click on the data points on the graph, which will bring down another menu here that gives a bit more detail on that specific data point. And if it is a big enough number, you can click on that and it will open up to kind of give you an actual episode list of the cases relevant to that data point. It does take a minute to load sometimes. And just a reminder that this feature really is only available with our Blue Cross Blue Shield cases and our Medicare Acute E cases. So as you can see, it kind of shows more detail on each case, and then it breaks down the payment for the case too as well, and also shows index length of stay. So that can be pretty helpful for you. Going back to the episode payments report. All right, I think next we're going to move on to our episode utilization rates report. And I'm going to go back and click on the Blue Cross Blue Shield square here. And I'm going to move on down to episode utilization rates report. As you can see, it kind of maintains the same site that you had selected. And then also it kept the service line and the condition. It doesn't always do this in every report, but it does for quite a few of them. So you'll want to double check that that's still there when you're looking at the other reports. This report shows readmission rates and post-discharge rates for conditions, and it also has similar filter selections like the previous report. You can select data points on the graphs as well, and dig deeper into the data, just like the episode payment condition or episode payment report. And it gives a breakdown under post-discharge rate and readmission rate here at the bottom. So currently I am on the readmission rate for sepsis episodes of care for this site. If I click on the post-discharge rate, I can actually expand this and it will break it down into all of the different sites of care that sepsis patients utilized post-discharge. Clicking on the row of whichever service you want to look at, you can also click the data point for this report. If there's enough cases, you'd be able to look at it. I don't know that we'll be able to look at this because we don't have more than 11. Let me see if there's any others that have higher numbers. Okay, so this one's got 71, so we can look at this. This is our skilled nursing facility. So we open that up. And it takes a minute, and there you go. So it kind of brings it back and kind of gives a good breakdown of each case and all of the different information you might want for that utilization. The next report we're going to look at is called our readmissions report. And this report has similar filter options. Again, the service line stays the same and the medical condition is the same. Similar filters at the bottom. Here, the report breaks down readmissions for sepsis patients within a certain time frame. So on our table here, you can open up the readmission rate, and you can actually select the rows for folks who were readmitted in less than 4 days, or 4 to 7 days, and up to 15 to 30 days. And then below that, you can also look whether or not they were readmitted to your facility or another facility, which kind of give you a good indication of that. The next report that we're going to look at would be our comorbidities report. And this report includes similar filters for selecting sepsis as the main condition, but it also allows you to look at different comorbidities like CHF and COPD, diabetes, and ESRD. So if you don't want to have all of the comorbidities included in the condition category breakdown, you can select one. So you can select, let's say, CHF, and that'll adjust the data to just reflect episodes of care where it was sepsis, and the patient also had a comorbidity of CHF. And then this includes different conditions that could also be included in those episodes of care, which can be helpful if you're kind of looking at a more complex pathway in different patient populations. And then our last report is the payment by condition report, which is on the top left here. And this report includes a table of various conditions and provides a look at the cost utilization of services for certain conditions for a site versus MVC all. So in this report, we don't actually choose the service line or condition on the filters. You can choose a comorbidity. For the sake of this report, I'm just going to leave it on all. There are some other patient demographics you can fill in, and then at the bottom, what's a little different is that we actually do have outcome measures that you can modify. Um, and this helps to kind of give you an idea of the location of where these patients go post-discharge, and then other services that are utilized, such as radiology, labs, or ED visits. So if I open these up here, you can see that it kind of has a nice big list of the different things that you can kind of filter out if you like. And then also you can change the time frame. So looking at the condition list here, you're going to look at sepsis specifically, you're going to want to scroll down. It's in alphabetical order, and then you would select sepsis. And then that's going to reflect in the graphs above here. And this kind of gives you an idea of how your site compares to the MVC all average with total cases versus a rate or yeah, versus a rate. So this is the total number of cases, and it's reflected in payment, which we, as I said before, use as a way to look at utilization of services. So I'm hoping that was helpful for everyone. Next, I'm going to be reviewing some information about our P4P reports,
Rachel,
which, yes,
sorry to interrupt you. There's a
it is.
few questions that came into the chat during that,
Okay,
and I think maybe we
it'd be
might
good to.
to answer those before we jump into the next
Sure.
report.
Can you read them to
Yep.
me? Okay.
So we had the one question was, is the rank high or low? And that came through when you were looking at episode payment kind of at the beginning.
Okay.
Uh,
Let me go back here. Okay. So the rank, so it's out of, let's see, the total cases. So, and if
so
there's, go ahead, Jess.
just one other thing I just want to say. I know it says 6 out of 10 here. Remember, this is a training site, so there's only
Yeah.
10 hospitals in here. But when you look at this on the registry, that number will be quite a bit different in that column based on the number of hospitals of MVC that are in that registry.
Mhm.
So that's kind of where you are out of that. Just wanted to call out that, we have limited hospitals in here, so it looks quite a bit different.
Yeah, yeah. Thank you for clarifying that. So yeah, so the ranking is usually showing the number of cases in this instance out of the total number that falls under the filter designation that you put in. Um, and hopefully that helps answer your question. Um, Jessica, did you want to move on to the next question?
Yep. Then, is there a way to know what episode ID is on our own medical records? And I think that question is probably, forgive me if, or jump in if I'm incorrect, but probably looking at trying to connect that episode ID when we drilled into it with what you have in your medical records to try to match those up. Is that right, Monty? I see your hand is up.
Yes, yes.
Yes.
Yeah, you can identify which patient had that episode on our site and deep, deep on it.
So when you click into the episode on that line there, you can drill into some additional details, but the episode ID number, you may not necessarily be able to correlate that to your medical record numbers easily without looking at some of these additional details. Does that
Yeah.
help?
Yes,
Okay.
the question before, like if we are 4 out of 10 on an episode of payment,
Mhm.
does that mean that we have, okay,
Sorry.
there are four hospitals that charge as much? I mean, I don't know if it's better to be 1 out of 10 or 9 out of 10.
So The other quick reminder I'll give is that these are standardized, price standardized, so they're not exact dollar amounts. It's more of a measure of utilization. So it's not necessarily that you're charging more than 4 other hospitals, but less than 6. It's more of a utilization. So your utilization is been price standardized so that it kind of can make a little bit more sense when we talk about dollars and cents, but not exact dollar amounts that you're charging patients. Does that?
Right, but no, is it better to be lower or higher
Um,
compared to MVCO?
I would think that you'd want to be lined up either with MVC all or attempt to be at a lower amount if your goal is
Okay,
to lower utilization of
low.
services. Yeah.
Yes, if I want to compare to what other facilities.
Yeah.
Yeah.
Okay, lower. Thank you.
Yeah, you're welcome.
And then another question that just came through is it not seeing the post-discharge rate on the when she logs in. Is this because I don't have more than 11 cases? That's possible, but it might also be that we may need to hop on a call with you, Daniela, and look a little bit more closely one-on-one because sometimes it's not as easy to follow along on a group setting as if we were to jump on a call with you.
Yeah, absolutely.
I
Feel
did
free to.
find it. It was
Oh,
my
great.
mistake. I was
Okay.
clicking on the wrong section, so I did find it. Thank you.
Okay. Wonderful.
Sometimes that happens, yes. And then Irene, your question about how do we use this to data to help drive improvement, we're going to get to that a little bit more in detail when Janet comes on with her custom report. So I love the question, but that's where we're headed.
All right. Okay. We're good?
Yep, that's
All
it.
right. Okay,
Sorry,
cool.
trying to get through those quickly so that we could
No, that's great.
also give Janet some time.
No, that's perfect. So now I'm going to be moving into our P4P portion of the reports. Like I said, we don't have those on our training site yet. We are hopefully going to have those in the future. But I was able to kind of put them together on some slides here. So in the registry, we have our P4P reports available. Why did it do that? Okay. And 2 of the reports are going to be very helpful for you to look at your sepsis metric. Currently, we have a volumetric summary report, which will show you performance year 2023 or 2024 data for all the volumetrics that your site has selected. You can also modify the report to reflect just the one metric that your site has selected. And then we also have the volumetric trends report, which kind of gives a really nice visual trend line for the metric for your site, which you can adjust on a timeline. And just a reminder that this preview is a preview of the baseline year performance for PY 2026, which has a baseline performance year of 2023, and then PY 2027, which has a baseline performance year of 2024. We are working very hard right now to get the updated P4P metrics live on our registry. As you'll see in my slides, we still have some of our metrics from the previous program year, but coming soon, we're going to have that 14-day follow-up for sepsis live, and you guys will be able to check it there. So this is the first image I have for our volumetric summary report. This table gives a breakdown of several different metrics here, but what you'll find is when you're in the report yourself, you'll be able to select your site, or if you have multiple sites, otherwise it'll just have your site. You'll be able to select the performance year you want to look at, and then you'll select the value metric here. You can either leave it on all, or you can go in and select your selected metric for the program year. When you're looking at this table, what will be helpful for you will be to look at your performance rate for that metric. And that is kind of where you're currently standing in performance compared to the overall performance. We also have a column for the improvement baseline rate and then the achievement baseline rate. When you are trying to decide whether you're going to be going for improvement points in P4P or achievement points in P4P, these columns are going to help you kind of make that decision or show you how close or far away you are from the goal. So for improvement, this is your site is at or doing better than the goal rate, but you're still improving. So to achieve improvement points, you would have to hit this percentage. And then for achievement, your site has not yet met the desired goal, but will gain points as the rate improves. So to achieve or to receive achievement points, you would want to be looking at aiming towards this goal. And that just kind of gives you an idea of kind of how much might need to be done to kind of meet that goal need. Um, for the volumetric trends report, this gives a nice graph of your hospital compared to your cohort average. These are hospitals that are similar to yours. And then it also includes an MVC average line as well. In the filters for this one, you can select your P4P volumetric and then the hospital. And then you'll be able to adjust the trend date here. And it goes all the way back to, I think, 2016 Q1 data, if you so choose to look at that. But for the purposes of today, I put it to 2022 through 2024. If you'd like to download a graph like this on the registry, there's actually a really easy way to do that. And I believe, I'm just going to pull up the registry really quick again to show you. When you have it open, there's usually a little box with an arrow here right by the graph. And if you click that, it'll let you zoom in. And then on the top right, there's this little page with an arrow where you can export the graph, either as an image or PDF, Excel, or Microsoft Word document. So that might be helpful for you if you're ever trying to use these in a presentation to show leadership or other interested parties. All right. Okay. So hopefully that gives you some ideas of how you can use the P4P reports. Next, we have a presentation on a recent MVC custom report for sepsis and palliative care. Some of the other areas of interest that we've focused on for sepsis custom report work include sepsis readmissions in relation to certain conditions or procedures, and then sepsis post-discharge follow-up care, tracking when patients were seen after discharge and where they were seen. Emily, if you want to pause the recording, that would be great. If anyone has a question, you can feel free to raise your hand or put it in the chat. We have a couple minutes left.
I'll just make a quick comment while people are maybe either typing in their questions. But just wanted to come back to Irene's question earlier about how do we use this data for to drive quality improvement. And I think my biggest recommendation would be to approach the registry with a curious mind and apply the 5 whys when you're looking at the registry, and then use that to then further ask us, how do we dig into this a little bit more and figure out where the areas of opportunity for improvement might be by benchmarking yourself against other sites, because obviously readmission rate's never going to be 0, but what is the right number? That's a little bit easier to figure out when you're looking at how other hospitals like yourself or in your area are doing on that same measure or metric. But the biggest thing would just be approach it with a curious mind when you go into the registry.
Thanks, Jessica. And then Catherine put in the chat, if we want a custom report, do we reach out to Janet directly? No, you don't need to reach out to Janet. We actually have a link for you to use to fill out the request. which will provide us with the details needed to set up a planning meeting and then proceed with developing the report. So I will include that link in the email I send out to everyone that has attended today. So you'll be able to look at that and see what you might need for sending that in to us. Any other questions before we move on? Seems like we're pretty much wrapped up there. All right, I'm going to keep going here. Let me get my slides back. So moving into our upcoming work groups, our next work group is going to be Thursday, January 29th. And this is a health and action work group. We are going to have a presentation from Corewell Health Farmington Hills. And this will be on their surgical site infection QI that they worked on diligently for actually 2 years. So they're very excited to share their success and hard work on that. And then the next work group will be our cardiac rehab work group. And that is going to be on Tuesday, February 9th. We will be hosting a panel of cardiac rehab professionals from several MVC sites. So we hope to see you guys there. If you missed any of our last work groups, you can always read the highlights in our blog that's on the website. And then be sure to be on the lookout for the blog for January's work groups. That should be coming out in early February. Upcoming events that you might be interested in. We do have a February virtual networking event in the early planning phase. The topic is going to be focused on relational coordination. So Google that if you're interested to kind of learn a little bit more before that comes up. We will be choosing the date very, very soon. So keep your eyes open for announcements to register for that event. We also anticipate having our MVC process measure reports coming out soon. And then also looking ahead a little ways, the P4P final scorecards are anticipated as well. We will definitely let you know when we have a finalized date for send out on those. And just a reminder that we are always looking for presenters for either our work groups or our spring collaborative wide meeting, which is coming up this May. We will be in Traverse City for that. And there are details about that, I believe, on the website. And then if you would like to present, I'll include the presentation proposal link that you can use to submit any ideas you have for any of those upcoming events. And with that, I want to thank everybody for joining us today. Thank you, Janet, for going through that custom report. It was very informative. We are going to share our post-work group survey link in the chat now for all of you who would like to give us feedback or need to fill that out for your P4P points. We will also include that link in the email as well. Just a reminder that if you are filling out the survey for P4P, to only select one hospital to receive credit for your participation today. Otherwise, thank you so much, and I hope everyone has a great day.